The first case of the COVID-19 pandemic in Kerala was confirmed in Thrissur on 30 January 2020. Kerala was one of the lowest mortality rate in India with a 0.37% compared to the national average of 1.9%. Kerala's success in containing COVID-19 has been widely praised both nationally and internationally. Despite the high number of the cases in March, by April 30, Kerala had reduced the rate of increase of new cases to less than 0.25% per day. But now the state is witnessing a spike for the second wave in the daily new case rate following the return of the Keralites from other countries and within the nation by July 2020. More than 70% of the known cases were due to the community spread, with more than 21% of the state cases in the Thiruvananthapuram district, a report. In the last 8 days alone, 14,055 positive cases and 65 deaths have been reported in the state. Till May 4th, the state has only 499 positive cases. But on August 20, the number of positive cases in Kerala stood at 52,199. So far, 192 COVID deaths have been reported, including the Mahe native who died in Kannur in April. The reason for the exponential spike are many and much discussed, but in the hindsight, the one overwhelming reason was a false sense of security fostered by the State Health Department. A technical paper issued by the Health Department as late as June reiterated that the state was not experiencing large outbreaks of local transmission and that there were only a few cases not linkable to transmission chains. The supposed absence of the multiple unrelated cluster in several areas of the state lulled everyone into complacency. With India's COVID-19 recovery rate going past 74% on Friday, is the country now approaching its peak. A record 62,282 patients have recovered and were discharged in the last 24 hours, taking the total recoveries to 21.5 lakh. A SBI report estimates that India will reach its peak of cases when it hits 75% recovery rate based on the trends of other countries. But even when as the state case lot is increasing at a higher pace than the national average, Kerala's fatality rate is the lowest in the country at 0.3. At present, the state has only 157 COVID-positive people admitted in the ICUs and only 37 people on ventilators. The recovery rate of the state is 65%, which is also impressive. The good thing is that only 1% COVID patients are in ICUs, so we may be able to accommodate double or more the number of the active cases if the ICU admission rate remains similar, said Dr. N.M. Arun, internal medicine expert. Experts point out that the state is likely to witness 5,000 cases a day by next month. We have to go ahead with the present strategy in increasing testing, maintaining social distancing and making masks an integral part of our life. That's the only remedy for containing the spread, said Dr. S.S. Lald, noted public health expert who was with the WHO earlier. Bureau Report.